It's important to think about medical emergencies and even the trauma emergencies that we want to create a problem list or differentials. When we are asking our history questions, this is your OP curiosity, onset, provocation, palliative, quality, severity, time, sample, signs and symptoms, allergies, medications, previous medical conditions, or health problems, last oral intake, and any events leading up to this situation. As we ask these questions and we take that information in, we're collecting data to develop our problem list. An example, when we get to a patient's house and they're complaining about being fatigued or faint, there may be other symptoms that they also list as we go through our sample and OPQRST, such as nausea, vomiting, maybe some diarrhea. What we want to do is try to put all of these symptoms and look for the signs and create a problem list. So initially, let's go back to our patient. We have some nausea. And we're just creating a problem list. Now this could be what we start to decide is, are these symptoms or is this a medical emergency that we're looking for? Basically, we come up with this problem list and we create differentials. Now, what could be causing all of these symptoms? Well, it could be because they felt lightheaded and faint. They have these other symptoms, which could be a cardiac issue or an arrhythmia. Somebody who's having chest pain may have nausea and may feel faint. Now, this could also be food poisoning, for example, and they were nauseated, vomited, and had quite a lot of fluid loss because of that diarrhea and vomiting and not replacing it, and they could now feel that they're fainting. But what we're missing is the other sign and symptom, either a chest pain, palpitations where their heart is fluttering, or in the case of the food poisoning, that they have some abdominal cramping and stomach upset as a result of their intake and digestion of that food. Now again, this is a problem list, and as you go through the medical emergencies in the chapters ahead of us, we want to try to list these in a way that when we are listing these signs and symptoms, we can figure out what's going on. So again, we would create our possible condition that we're learning about, and then we would based on the signs. These are the things that we see and the symptoms, the things that our patients are going to say. So we would list the condition. What do we find on our patient? What does our patient tell us? And based on the symptoms later on, as we create our problem list, we'll list all the problem symptoms. Again, and we'll do this again. They said nausea, vomiting, diarrhea, and I think fainting. And now we'll have to list the types of conditions that could cause this. So I think one, I said food poisoning. And then I think I said one might be a cardiac. But as we look at this, I wanted you to find out that are there possibly other things that we could list in our problem list based on our patient's symptoms. Once we identify that, I'd like you to go back over and we'll slowly tease this out. What other signs are we going to look for? These are the things that the patient presents with. Pale, cool, clammy skin. The vomit that we find, either there might be food particles, blood, or it could be even an unintentional overdose where they took too many medications and they're vomiting up pill fragments and such. But the idea is that based on the signs and symptoms, we're going to list our problem list of possible conditions that could be causing our patient to feel this way. Again, this is our differential or our problems list. As we go through our learning the medical emergencies, the idea is for us to learn the condition, name your condition, and then list the signs and list the symptoms so that later on we can create a problem or differential list based on the signs and symptoms that the patients present with or they tell you.